Hello, everyone, and welcome to today's webinar. My name is Kaylin Rosenberg, and I am the Program Manager for the Carolinas Collaborative on Climate, Health, and Equity. I'm leaving my camera off today because it was sacrificing audio quality, so I hope you all can hear me okay. Before we dive into today's webinar, let's review a few quick logistics. So today's webinar is being recorded, and this recording will be made available on our website after the event. So please stay muted to avoid any unnecessary background noise. Having your video on is completely optional, and you are welcome to type questions and comments in the chat. We will have a dedicated time for the panelists to respond to questions towards the end of today's webinar. So today's webinar will explore the interconnectedness of climate change, food insecurity, and health outcomes. This is the third webinar in our multi-part series focused on community-engaged research. And to get started today, I'll tell you a little more about the Carolinas Collaborative on Climate, Health, and Equity. The Carolinas Collaborative on Climate, Health, and Equity is also called the C3HE program, and we are a National Oceanic and Atmospheric Administration Climate Adaptation Partnership, also called a NOAA CAP program. We are housed at North Carolina State University, and we are a multi-institution team composed of physical and social scientists, community leaders, researchers, outreach professionals, and students. Our work centers on building community partnerships to advance climate resilience and health equity. We work together with communities across the Carolinas to help address their exposure to climate threats such as fire, flood, and heat. Moreover, our team's focus is on understanding our changing climate and mitigating the impacts in a just and equitable way. We integrate science and regional knowledge to co-produce solutions that are tailored to meet unique local needs. We also focus our efforts on frontline and at-risk populations and thereby strive to support communities that are disproportionately exposed to climate hazards and other compounding social inequities. To share some of the work we have been doing, we are co-hosting this spring webinar series, and we are really glad you could all join us today. So now I will turn things over to today's moderator, Florence, who is a co-PI on the C3HE team.
Thank you. Can you all hear me? Right.
Yes.
Good afternoon, and thank you everyone for tuning in. And I hope the next 1 hour will be informative and engaging. And I also use this opportunity to thank our panelists today, Nikki, Seibert, Kelley, and Keisha Long. Their information, I'll let them introduce themselves for the sake of time. Today, as Kelley had already introduced or mentioned in the introduction, the topic today is triple threat, the impact of the connectedness between food insecurity, can no longer deny the fact that climate change is not only happening, but is actually becoming a crisis. We know that the climate change-related disasters such as drought, flood, impact not only our local food systems, and that ranges from the actual production Unfortunately, we also know, for reasons you'll learn more about during this discussion, that people of color, and especially African Americans, are disproportionately affected by these three factors that we're talking about. And today we'll dive more into looking at why, and hopefully look at some potential solutions. And so with that, I would call on Nikki to please tell us briefly about yourself. Well, let me introduce myself, sorry, before I go in. I am Dr. Florence Anoruo. I am part of the C3HE group, our team, and I am a professor at South Carolina State University and also a researcher. My work spans between agriculture, plant science, environmental justice, and climate justice. And so I would let Nikki introduce yourselves, and then we'll go from there.
Thank you, Dr. Anoruo. Florence and I have worked together for many, many years. We actually have intersected at work in a rural community in Bamberg, as well as currently working on the statewide South Carolina Food Systems Network, formerly the South Carolina Food Policy Council. So I'm really honored to be here and really respect the work that Dr. Anoruo and her team is doing to elevate the realities of this work. So my name is Nikki Seibert Kelley. I currently live in Travelers Rest, South Carolina, but I spent the last 18 years in Charleston. And my background is actually environmental science. So I have an undergrad and graduate degree in that field, but I've spent the last about 15 years working in food systems. And I'm really, really interested in people-centric solutions and place-based solutions. So I really want to honor and lift up the knowledge of local communities and find ways to engage that knowledge and bring it to the state level and really address those populations that are being hit the hardest from climate change. And just anecdotally, maybe also showing my age, when I was an undergrad, our professors were actively told they could not talk about climate change. It was too political. So while I was getting an environmental science degree, my professors were not supposed to be talking about, at the time, global warming. So I think it's really incredible we finally got into a place where we can actively and openly talk about the realities that we are and will be facing. Keisha, I would love to hear more about you.
Thank you, Nikki, and thank you, Dr. Florence, for the invitation. I am Keisha Long. I wear several hats. The biggest one, I am the Environmental Justice Coordinator for the Department of Health and Environmental Control, so South Carolina DHEC. I have a background actually in civil engineering and with a concentration in environmental. I don't remember discussing global warming inside the classroom. Outside, yes, but it was global warming then, climate change now. And yes, using that phrase was political. So we would use euphemisms like extreme weather or something like that, try to describe climate change. I'm also the project manager for a EPA grant we were fortunate as an agency to receive called EJ Strong, where we discuss community managed disaster response, and food insecurity and food access was a big portion of that particular project that started in 2020. We have been fortunate enough to receive additional monies to continue our work, where we work in communities to discuss what communities consider their priority hazards and also come up with action plans to mitigate and respond to those hazards. And one other hat I wear, I'm a member at large for the South Carolina Public Health Association. And the association has a grant from the American Public Health Association on extreme heat and flooding. It's called Smart Surfaces. So it's more of a mitigation project to try to reduce the heat in urban settings mostly. So thank you for the opportunity, and I look forward to the discussion. Dr. Florence.
All right. Well, thank you so much for that introduction. And Ms. Long, and I know you had a short time. We have worked together on several EJ-related work through DHEC and also through the EJ Long. So our work really intersects, and I so proud of what you're doing and what collaboratively is being done through those projects that you mentioned. So since you've introduced yourself, and I think you probably segued into the next question, which would be tell us about your work, including our collaboration and over the past few years and how it is tied to this webinar topic. And Nikki, or you can start, and then turn it over to Keisha.
Keisha, you're already unmuted. You can take it.
Okay. Well, I just really quickly, as I said in my intro, that we are working on food access as part of the community managed disaster response. And going back to the beginning of this, the idea of EJ Strong, we have a collaborative group of people that we work with, environmental justice leaders, including Dr. Florence. And at the time, there was a facility in my county, Richland County, where I live in Columbia, that was having a lot of maintenance issues, and they mess with nuclear materials. So that was a big concern with the community. What would happen if something blew up? We would get reverse 911. If we're told to shelter in place, what does that mean? And things of that nature. So that's how EJ Strong was born. So we have these discussions before something happens. And as part of that, with the food security, Clemson University, during COVID, they created a food access map for the 10 upstate counties surrounding the university. They noted that students and staff were having trouble accessing food. So they mapped the food pantries, farmers markets, and other locations, nonprofits that were still open and were serving the community. My colleague, Karen Sprayberry, saw this map and asked Clemson University to join us with the EJ Strong project to expand this food access map to the entire state. And they did. So we have about 1,000 food access points on the map right now. As I stated earlier, we received additional funding. So Clemson University is going to do some upgrades to the map. So right now is English based, so we want to be multilingual. Also, we want it to be more user friendly, and also have the ability for people to print the different locations they're interested in. So we still have people who need paper, and I totally understand that completely. Nikki?
Excuse me, as you guys will notice, I love to share links. So Keisha, I dropped some of the links from your programs and maps in the chat so folks could see those. Yeah, so as far as my work in this space, I was contracted in 2022 as part of a statewide grant called Growing Local South Carolina. That was the initiative of, at the time, the South Carolina Food Policy Council. They're undergoing a name change, so they're now going to be the South Carolina Food Systems Network as they absorb the Growing Local SC initiative. And this was something that was, for those that were working in the food system, kind of that like beating the drum of you have to have grassroots to grass tops connections. We need infrastructure that can get local food into local communities. And there had been a study done in South Carolina. At this point, it's been, I think, at least 12 years. And it really highlighted that we're importing 90% of our food, even though agribusiness is our #1 industry. So we're producing incredible volumes of food and we are shipping it out of the state. And when you have these really externally dependent systems where it's not community driven, it's economically driven, it's not socially driven, the only value it places is on money. And when you have a collapse like during COVID, in which these national distributors are contingent upon massive amounts of underpaid labor, and those systems collapse, we realize the reality that grocery stores only have 3 days of food on the shelves. And so it finally got to this place where we have been, trying to scream from the rooftops, this food system is not sustainable, it's not resilient. If we have a minor disturbance, it can get off the rails. If we have, like in Charleston, they call it Sunshine flooding, it's like when there's a high tide and it hasn't even rained and the streets are flooded. During the 1,000-year flood, we saw 95. That is the lifeblood of globalized food systems entering into South Carolina. You very quickly realize that we don't have the control we thought we had over our food system, and that makes us very vulnerable. So we had been trying to apply for funding to create a statewide network specifically focused on building relationships in cross-sector collaborations so that we could identify place-based solutions and elevate the voices of communities that have been historically underrepresented and under-resourced, and really shine the light on the opportunity to rebuild a food system that is community-driven. And so we received a USDA Regional Food System Partnership grant in 2022. And in this sense, it was very timely because we had all just lived through the first iteration of a federal intervention on food access called the Farms to Families Box Program. That just further highlighted how much we were continuing to rely on traditional systems. Local farmers were not able to access those contracts. Local food hubs weren't able to access those contracts. And then the folks that were being contracted to distribute did not know the communities. So you guys were watching the news and seeing people dump gallons of milk that were not being picked up. And you were seeing tractor trailer loads of fresh produce being dumped at these pantries that people did not have transportation to access. So the beginning of our grant cycle, a program called the Local Food Purchase Assistance Program was released as a response to the incredible backlash to the initial federal program. And it specifically highlighted in USDA terms, socially disadvantaged farmers, which in our space is code for predominantly Black and brown farmers. And we were lucky enough to have had this grant in place, to have the manpower to advocate and to build connections to ensure that South Carolina's version of that program truly served Black farmers. And so through Growing Local, that's an example of the ways in which having state to local connections, having a state organization that has folks like Dr. Anoruo on the board to advocate for our state agencies, to push for these programs to truly serve the community. It really showed the power of network. So the grant spends over a third of its budget specifically contracting grassroots organizers to connect local folks with the resources that are already available that they may not be aware of, whether it's doing it in Spanish, doing it in print. As noted, Keisha, I'm also a print kind of gal, and doing the relationship building. And then also surfacing like, what are the realities? And, for rural communities, especially, transportation continues to be a massive issue. So if we have these intervention and programs, how do we acknowledge the realities these communities are facing and build place-based solutions? So as an example, in Bamberg, as an example of a rural community, they were able to use the school bus routes. Knowing that kids are being dropped at those routes, knowing there's families at those routes, doing box distributions, using school bus routes, being able to push notifications out through the school system to ensure those families had access. So while my passion is farming, and I can tell you about the health of soils and the resilience of soils, I'm happy to talk about that later. I think that the same thing that Keisha was finding and experiencing was the power of people. So I think that's a lot of what we have been focused on, is how to elevate those voices. Because especially in the food systems world, the dominant leadership is middle-aged white men, which there's nothing wrong with that. But statistically speaking, you are more likely to design and network with folks that look just like you and live just like you. And if that is the case, then we are missing an incredible amount of people in the community, and those programs, and that the dollars being spent at these state agencies is able to actually serve the broader community and able to connect from a relationship standpoint with the networks that really need the resources of race and demographic and location. So I'm going to stop there. Y'all know I'm a talker, so I'm going to try and put a pin in that.
Thank you, Nikki and Keisha. To segue to the next question, I just want to mention some statistics to give us some background as to the next question. So in 2021, there were million people that were food insecure, and that includes those who are very low food insecurity and low food insecurity. In 2022, just 1 year later, that number rose to 44 million. That's a whole lot of people that are not sure where the next food is coming from. And out of this number, half of those numbers, more African Americans are 2.5 times more likely to be food insecure, either sometimes or most of the times. That's just to give you some idea of the connection of what we're talking about today, and hopefully you get a better understanding of why this is very important. We highlight this problem and more importantly, find solutions such as the ones that Nikki has mentioned. So now going back to climate change, the same people that are twice more likely to be food insecure when it comes to the impact on climate change on them. Here's the statistics. African Americans and people of color are 50% more likely not only to live in highly polluted area where the health outcomes are much worse than it's supposed to be because of exposure to pollution, but they are also 50% more likely to be impacted by climate-related disasters such as flood, extreme heat, and other factors that are connected to climate change. But the question, the biggest problem is that with all of this, the health outcome of this group of individuals, people of color, especially African Americans, becomes widened because now, especially, they're also known to have more of the pre-existing conditions with asthma, heart disease, and obesity. And all of these are determinants of health outcome. So when you combine all of this, and as we discuss more, you will see why this is really a triple threat. Those three things: food insecurity, climate change, of course, health disparity. So Nikki or Keisha, any of you can chime in. The second question says, can you explain the connection between climate change, food systems, and health?
Keisha, I was trying to not.
Well,
like this is your jam, Keisha. I don't want to.
You think so? I was just thinking about that, and as
I'm happy to jump in.
As Dr. Florence was talking, the one thing that really jumped out me is how we set up our society, and I specifically zoning, and we I'm thinking specifically about redlining. So historically, we have put certain things in certain places and certain people in certain places through segregation and other racial and discriminatory practices. So, for example, let's talk about my family. Grew up in Eastover, my mother's side. The plantation where they were slaves is still there. It's rural. Right now, there is a coal-fired power plant there, and there's a chemical plant there. All these things that came in after the Civil War. So these things were intentionally placed there, and they're polluting facilities and adversely impact health, or can, if they're not run properly. And then since it's a rural area, you have very few grocery stores. Traditionally, they were agricultural. They grew their own food, but we've gotten away from that now. And then there's no hospital. So just right off the top of my brain, the main issue is how we set up our society with places and things and where we put places and things. Add climate change on top of that. We have the extreme heat from, and then it gets worse with the asphalt and the concrete and all of these things to cut the trees down, which actually helps cool the earth. The connection, just thinking more urban, there is a zip code 29203 in Columbia. It's an Eau Claire community, and it also has the highest number of amputees in the state. And this is in Columbia, where we have 3 major hospital systems. There's a food desert also. It also is one of the hotter places in Columbia. There was a heat mapping study done 2 summers ago, and by USC's Department of Geography. So you have these cumulative impacts that lead to negative health outcomes. Nikki?
You like really, we were having a mind meld. If I could show you my screen. When she was talking, I wrote redlining at the very top of my notes. I think that, you know, to the point of both of y'all is that what we're looking at is like, we're coming into an inequitable system. We're coming into an intentionally disadvantaged and like a selectively disadvantaged situation. And I think about Charleston, and I think about where the communities flood, and I think about where the interventions happen from a government agency standpoint. And this is not like a, how did we end up here? You know, like, or that there was some choice, like, oh, people chose to be in this neighborhood. So I think it's important to start there, knowing that if we think about all of ourselves, if any of you guys are homeowners, the thought of choosing to sell your home, like you have to actually have enough money to sell a home and buy another home. And if you have roots in that community and that's your social network and your system of support, when I actually did some Hurricane Katrina relief, and people kept saying like, why didn't people leave? Why did they stay? And I'm like, you've obviously not lived someplace with hurricanes. When you're talking about a situation where my mom lived in Fort Lauderdale and I grew up in the Carolinas, like you don't leave for hurricanes, especially when you're dependent on that next paycheck, because your boss does not care that there's a hurricane and you are expected to come the next day and you can't afford to not be at work the next day. And then when you think about leaving, where are you going to go? Like literally, where are you leaving to? Not everybody has this vast social network or a car, or even the funds to take a bus somewhere. And if they get there, can you afford a hotel? Like, how are you going to get your next paycheck? So I think when you're already in a place where you are financially vulnerable, and that there's crazy statistics about people being one paycheck away from homelessness. I was actually a housing caseworker during the housing collapse. And the reason it was so shocking to people was that people that had never had to access public benefits all of a sudden needed foreclosure prevention, and they didn't even know where to go or how to access those benefits. So I think people are through COVID started to wake up to the fact that this can happen to anyone, and that it can be something that's beyond your control. And I think that it was awakening for people to realize that this isn't like anyone's fault. Like we as a society need to be addressing these issues and be lifting up and addressing these issues, because it is deeply inequitable. And to your point, Keisha, about that zip code, this is having like immediate and detrimental impact. You can put numbers to it. You can talk about the cost to society, the cost to healthcare, but just from like a sheer humanistic justice standpoint, we have to create systems that are thinking about and addressing the challenges for those folks that are already living so on the edge. And when it comes to farmers, the average Black farmer in South Carolina is making around $10,000. So we're talking about a demographic that's already not making a lot of money, and that the greatest land loss we've seen historically amongst the farming community, the highest proportion is Native Indigenous communities, and then the second highest is Black farmers. In the Southeast, we're seeing that often because of unclear title heirs property challenges. But what's happening is folks are losing access to this land. And I don't think people understand that when you're living as farming and that is your only income and your land is your only asset, if that land is starting to flood, if development is encroaching on your land and your neighbors all of a sudden are very upset with your production practices, or that you have hogs, or whatever that may be, this is a really big challenge specifically for Black farmers. Now, I will say that there are very few millionaire farmers of any race, and farmers in general. Statistically, 70% of farmers have to have a job outside of farming, which is in and of itself is an issue with our food system. Our farmers cannot make a living. It should be perceived as a public service. We are wholly dependent on that. Only 1% of our population is farming. That should scare everybody. And as noted, we're only looking at 3 days of food that's in the environment. But I just want to point out the environmental ecological aspect of this. Like, we are dependent on soil, water, and weather. So our food system, they literally trade commodities like stocks. And so we see these collapses if there's drought, if there's wildfires, and the quality of our soils can be degraded when there's inconsistent rain or high temperatures. And then the farmers and the farm workers themselves are literally out in the elements having to push through this. It's flooding. They're out there harvesting and burning the midnight oil. And despite all of the work and efforts and opportunity, right now we're seeing that folks working in the supply chain have the highest enrollment of any other workforce in SNAP benefits. So literally people that are growing and harvesting and processing food are at highest risk for food insecurity. Again, like this should be a red flag. Like, our system is not effectively supporting our communities. And I highly encourage, if you want to understand what this severe disruption and bounce back could look like, is looking at Cuba. So this is a community that, for political reasons, was unable to import petrochemicals, and they were overnight forced to adapt their production systems. The dominant systems in the US are using externals. That's, they're applying fertilizers, they're applying pesticides, herbicides, and they're trying to control the environment. And that allows them to have more predictable yields. But when we think about systemic long-term, that means you're creating a dependent system. Those seeds are being bred to depend on those chemicals. And in the case of Cuba, they showed us, they called it the special period, but we're talking about massive lives lost in poverty until they were able to bounce back and create a system that was stewarding the soil so that the soil could reciprocate and support them through producing nutrient-dense food. I think it's important when we think about Cuba. I hear it a lot in the agricultural field, is this like, let's lift it up as this incredible case study, which it is, but let's not ignore what the repercussions were of having an extreme cutoff. So they went from petrochemical dependent to not having it. What was the consequence of that? How do we soften the blow of a disturbance, which is when we think about climate change, when we think about with the word resilience, what we're talking about is the ability to withstand a disturbance and not have it be catastrophic. So I think we really have to get back to honoring those communities, understanding their challenges, and helping them create production systems, production plans, distribution plans, transportation plans that can overcome whatever their challenge is. Is it drought? Is it flooding? And be really, really intentional with how we reimagine those systems, because it's not going to be a one size fits all.
Thank you. Actually, the next question, both of you have actually sort of, I will ask, maybe there are a few more things that you need to add to this. So Nikki, this is for you. How has climate change affected our local food system and access to healthy food in the Carolinas? And what are the different impacts to rural versus urban communities? You've covered the first portion of this question, but more importantly, what do you see is there a disparity in the impact on rural versus urban communities when it comes to food access and all of that?
Yeah, I mean, I think ultimately, when you get into larger food distribution, they talk about you're not actually distributing food, you're running a trucking company. So when you think about it from a strictly logistics standpoint, the cost for distribution, your best and highest use is to do a distribution in a population dense center. So that means that grocery stores, trucking companies, distributors, they are focusing their energy, again, driven by economics. The biggest bang for the buck is in an urban core. So they're making less money and the quality of the product is dropping the further it gets from an urban core. Because I think people forget that while we have been able to adapt our food systems to create borderline shelf stable perishable products by doing things like harvesting tomatoes green and then gassing them when we're ready to put them on the shelves to turn them red. If you've ever wondered why a tomato at the grocery store tastes like nothing and a garden tomato tastes like something, it's because it's literally not nutriently equivalent. So you're taking perishable food and it's having to travel further and further. And the more it changes hands, the more it changes temperature, it's going to degrade in quality. And so not only are you having harder times accessing produce and fresh food in these communities because it's not economically beneficial for a grocery store or distributor to serve those communities, you're also getting lower quality food because they're not driving straight from the distributor to Allendale. Like they're going to have hit multiple stops. That truck door is opened and closed multiple times. So if you ever wondered why the produce is like so terrible, it's a very logical reason why it's happening. Now imagine you bought from a local farmer and they brought it to your grocery store directly. Obviously it's going to be more nutrient dense, have higher quality. So just from a transportation side, that's one part of like why the quality and why it's harder to access it. It also becomes more expensive. The further it's traveled and the more stops, it is more expensive. So grocery stores are going to charge more for produce in a rural community. And on the other side, when you're working with pantries and food banks, this is an example of just a reality of a program implementation. The local food purchase did not even get reached. So some of the most insecure counties in the state didn't get reached by that program because you were sourcing out of state distributors who did not care, nor did they know where people go to get food in a rural community. And so we were really excited about it, but the program was so focused on the sourcing getting paid for their time. And I literally heard people on calls say they get funded for that. I'm like, from who? Like these people do not have training or equipment in doing perishable products because we all know that realistically most homes in underserved communities and under-resourced communities, some of them are only a microwave. A lot of folks don't have access to or have been exposed to cooking skills. So, and then when we think about the best bang for your buck, it's going to be a canned good. It's going to allow the most out of it. It's in a lot of cases, it's low cooking inputs. And so these pantries were fresh health. When we think about healthy food, the healthiest, most nutrient dense is fresh. Interestingly enough, sometimes it's actually frozen because it's been frozen at peak ripeness. And then you get to heat it right back up into peak ripeness. In some of these communities, the produce they're getting is probably less nutrient dense than the frozen because of how far it's had to travel. So those systems are already really inefficient and very relationship based. So when we think about climate change, when we think about a route being disrupted, when we think about a truck gets blocked on 95 because of flooding, that means that quality of food and the access to food is only going to be further impacted. When we have worker strikes and processing, those rural communities are going to be the last to be served. And then when we do have interventions, they're not going to take into consideration nor fund transportation innovation. We're seeing that now in local community solutions where they're leveraging DoorDash and other mechanisms to get food to these communities. But our traditional interventions are designed around the urban core. Because again, most of these folks are from and live in an urban core. They can't even see the reality of trying to get food into a rural community. And we know those health outcomes are worse for those community members. And this is all tied to that. So I'll stop there.
Thank you, thank you, thank you. You covered all of it. So, and a lot of times people, there is this misconception that if you live in a rural area, you have you have a lot of farmers there, you have access to fresh produce and fresh food, and it's not. So thank you for that. And Keisha, I want you to, the next question is for you, that and this time you're looking at the impact of climate change and food insecurity and health outcomes, looking at the urban versus rural communities, looking at from the lens of health outcomes and health disparities. And I know you've covered, you kind of covered it in your previous question, but if you want to add anything before we move to the next question.
Right. Yes. So one thing I wanted to discuss about, and actually to piggyback on what Nikki was saying about the food cycle, really, there's another part to this whole system, and that is wasted food. So once we get from the farm to the table, then we get to the trash, and 40% of our waste is food. So on the front end, we have different systems to try to make the most money, and on the other end, we have the waste. We try to make the most money, and where are the landfills? They're in rural communities. So we're out of landfill space. It is a battle every time a company wants to install a new landfill, which is really difficult. More often than not, they want to expand a landfill that's already in operation. And there is encroachment from residential areas onto landfills, and it's a bad situation. So we have, in my mind, and I think this is a call to action that you wanted to discuss later, but we have to redesign our food system so that it's more efficient and it serves everyone. Because right now it is only serving certain people, and certain people are getting the negative impacts. So we have, as Nikki was stating, the rural and African American communities, people of color, are getting access to less food and less high quality food. And then on the back end, the same communities are getting the landfills and the trash. So yeah.
Absolutely. And just to add to what you were just saying, knowing that these two communities, the rural versus the urban communities, we know that the health outcomes are also very high in those areas. So when you add the fact that they have less access to healthy food, and they are eating more of the processed food, which is loaded with chemicals, and then exposure to the pollution that we talked about because of redlining and other things. That even widens the health disparity, of course. And then, of course, these populations are also have already underlying health conditions because of lack of access to healthy food and eating processed food, which is what they can afford. To hospital systems or medical care, that even puts them in higher risk of either death or even having different types of diseases that are connected to the environment and what they're eating. And we know that the projection is that climate change is going to continue to worsen. The way it is now, the projection is that the temperature is continuing to rise. The projection is that flooding is going to the frequency and intensity of flooding is going to go up, and these communities are now going to even face higher, bigger problems than the ones that they're facing right now. And that's a really, really big issue. So again, this is something that we continue to seek for solutions, and hopefully we'll find ways to make sure that everyone has access to healthy food and access to medical care, and the health disparity would one day be narrowed so that these people have better life quality. So the next question, and we're getting very close to the time. The next question is actually, what do you think are the potential opportunities to intervene and possible solutions? Just briefly, and then we give audience to take some questions. And Keisha, you can, and then Nikki. So what do you think are potential opportunities to intervene and potential solutions? And I believe you have mentioned some of it, Nikki, in your conversation, and also Keisha. So is there anything else that you want to add to that?
Yes, and I think the biggest thing is, again, we have to redesign our food system distribution, and we all have to be at the same table in the same place at the same time to discuss it, and have all the stakeholders who are involved in the process currently at the table. I understand that there have been different there's a food security council that was headed by DHEC recently, and they made several different recommendations to the legislature. So that we're not starting from zero, which is good, but from the farmer to the warehouses, to the grocery, to the restaurants, to the food pantry, and to the waste haulers, and everyone in between, I think we have to redesign our food system. It's outrageous that we import 90% of our food. I didn't realize that we had that statistic, but it makes a lot of sense. Dr. Bell from Clemson University gave a presentation to our EJ Strong group about how, you might be driving past the vast cornfields, but that's food for animals. It's not food for you and I to eat. So we do have that have that I think misperception from just the general population that there's lots of food being grown, but it's not necessarily food for us to eat.
Absolutely. Thank you. Nikki,
yeah, I'm gonna blow up the chat here. I won't deep dive into any of these, but again, the group I've been working with is the South Carolina Food Systems Network. There's a number of committees in that group, so you can be on the local food committee. They're in the middle of working to join forces with the Appleseed Anti-Hunger Coalition. You can work at the coalition level. So almost every county has a coalition that talks about and is working towards food-based solutions. So I dropped a few of those. The Office of Rural Health, Holspire, and the Food as Medicine through USC provides food council support. There's a lot of mini grants, like Holspire's got 2 right now. There's a lot of opportunity to kind of test out and pilot programs, whether it be there's a state level community gardening program under Clemson. There's a farm to institution program as well. There's pantry programs and education. There's waste programs. I dropped in the chat that, some of Keisha's colleagues. And just like you saw in the chat, there's people really pushing innovation. There's container gardening. There's ways that we're thinking about how do we get food. And I think that there's also folks really trying to address the distribution component. Is it Meals on Wheels? Is it box programs? Can it be all of these? We've got folks like Low Country Street Grocery. They call it the Robin Hood model. So they have affluent communities pay market rates and potentially purchase food for other folks. And then they go into communities that are pay what you can and leverage SNAP EBT double box programs. We've got farmers markets. We've got mobile farmers markets. City of Columbia just launched a mobile farmers market. So I think we're really seeing people push back. One of my favorite groups that has been really rising to the top through LFPA is Pick 42 Foundation out of the PD. They started the PD Farmers Coalition down there. really elevating and working with a local producer to get a local cow, to work with a local processor, and they do a raffle. So you get like a lottery to be able to get access to free protein. And they pair it with wraparound services. You can get your blood pressure checked. You can get a diabetes screening. You really have to create that one-stop shop for these rural communities to capture folks when they are in a place. So I think there's a lot of hope out there. And I think that as a coastal state, and that it literally hailed in Travelers Rest yesterday, like golf ball size hail destroyed my garden. Like people cannot ignore it. And I think that in some ways we're in a good place to be pushed to make change. So I'm hopeful for that.
Thank you so much.
Can I make
know
just a
that,
quick comment?
yes.
Oh, yeah, sorry. I'm Lori Elliott. I'm with Global Stratos, and thank you for the session. It was very informative. I actually work mostly with farmers and communities in Africa, so have similar problems, although they appear differently. But so we are working with Dr. Marvin Mankato at NCSU, and he has a mobile processing plant for fruits and vegetables that can be placed pretty much anywhere in rural communities. The thing I was going to suggest is, I don't know, it doesn't matter who, if you want to talk to me or talk to him about it, but there would be particular interest in helping with the indigenous and Black farmers to not only help provide food in their communities, but also to give them better incomes. A lot of the products that are produced by this processing plant are highly sought after in many different places, even through like the World Food Program, different places, people who do things in the United States. So there's actually a good chance of helping the farmers become more sustainable while still helping their local communities as well. So anyway, I just wanted to make that comment. I'll put my email address in there in case anyone wants to have any discussion. And we are funding. We got plenty of money to do this in different places.
Thank you so much. And I think we were actually trying to reach out for collaboration because at South Carolina State, we have different regional solutions that we're looking at. And that was one of the potential solutions. So thank you so much. And
Okay,
we'd love to
great.
have your information. Yes.
Okay.
So we have a few minutes for questions. So Kelley, any questions in the chat?
Yep.
We can take a couple.
Great. Yeah, I haven't seen any additional questions come through the chat. So if
Okay.
anyone does have a question, feel free to, or please share it in the chat now, and we can continue the discussion with our panelists for just a couple minutes. So
That's good. That's good.
I just want to give some shout outs.
Yeah.
I encourage folks to connect with the South Carolina Black Farmers Coalition.
Yes.
I highly encourage folks to check out Benita Clemens. She has an organization called Pharmacists. So it's women teaching women on food production. You don't need any previous experience. If you're into advocacy, I highly recommend Appleseed's Anti-Hunger Coalition. If you want to look at case studies, like I said, Pick 42 Foundation is doing some wonderful work in a very, very underserved community in the PD region. I've written about a few of these things on my website. I posted the link about some of the work that we've been doing that highlights some of these organizations. So there's some great folks out there that you can connect to.
Wonderful. Thank you for sharing all these resources and for all the wonderful contributions from you both, from all of you. Last call for questions. If there are no questions from the audience, any closing remarks from our panelists before we close out today's webinar?
For me, the main thing is thank you, Dr. Florence, and thank you, Nikki, for inviting me. I've written several notes about some of the statistics, and hopefully we'll get a copy of the chat with all the wonderful links that are being shared. So I just want to express my thanks for inviting me.
Absolutely.
Yeah,
all right. Nikki, any last word?
Yeah, I'm just really thankful. I really appreciate the work that y'all are doing and that continuing this conversation because we need it so much in South Carolina. And I think we're all overextended and under-resourced. So I think there's a real opportunity to leverage communication or collaboration to increase our capacity. Not that that's easy. Group projects are never easy. But I love seeing these crossovers. I love seeing NOAA being engaged in, different agricultural agencies and institutions, because this is not a simple problem. So we're going to have a complex solution. So thank you guys. Thank you all so much for your energy and time on this.
Yes, absolutely. Well, thank you all. This was a very important and a very valuable conversation today. This recording will be made available on our website, so please share it with anyone who you think would benefit from this information. And don't forget to join us for the 4th and final webinar in our spring series, which will be on June 25th, exploring coastal health and climate risks. All right. Well, thank you all for being here, and take care.
Thank you.
Thank you.
Thank you, everyone, for joining.